Hi everyone. I'm Shabir Moosa, Professor Moosa. I'm with AYZA Health, and this is a webinar by AYZA Health on helping those who join us, helping them understand what psychedelics are all about and how it may help your mental health. So welcome to all of you, and I will welcome shortly a guest who's a patient of ours, who's been quite kind to share his experience, and I will tell you a little bit more about him. But very briefly, the psychedelics, there are a range of them. I think that stretch from very traditional psychedelics like magic mushrooms, ayahuasca, that have been there for hundreds of years, and then things like LSD, MDMA, that have been around in the last 50, 60 years. But there's only one that's legal, and that is the Keta-Therapy, which we're using. It's an anesthetic. It's actually very safe. What I love about it is that it's hugely controllable. Given IV, one can switch it off very quickly, and there's a lot more literature available on Keta-Therapy than there is with any of the other psychedelics. And I think this is something that makes me feel much more comfortable with the depth of evidence and practice around this. Well, the literature is extensive. It is a really important value in terms of depression, especially suicide and anxiety, especially PTSD. The South African Society of Psychiatrists have recommended this therapy as for treatment-resistant depression. It's also extremely useful for substance use and chronic pain. Well, AYZA Health is a boutique service in Sandton, and it is providing this Keta-Therapy, but the idea is not for me to spend this whole hour talking and lecturing to you about it, but rather to have it in a very interactive way, and I think a really empowering way, where I get a patient who is with us, who has gone through this whole thing and who's willing to share their story. And I think that it makes it very, very special. So welcome to Sohail. Sohail is a patient of ours. I'm going to ask him to share a bit more about himself, but please, Sohail, don't share anything that you don't want to and drop details that you don't want to share. I really do appreciate your willingness to come up here. It's not at all easy. And to all of our viewers, our participants, feel free to change your name, rename yourself, so that you can keep safe in this space. And when you ask questions later, you can use either the chat to put out those questions or raise your hand, and we will try and give you a chance to speak. So if you're willing, I think that is the value that we'll get out of this. So let me ask Sohail. He's now, I think, hopefully visible. Sohail, can you make yourself?
I think the camera, the video is
challenged.
Is muted by the host.
Okay, let's just see if Zahra can use the, open the video for you. Oh, there you are. Good. Thanks, Sohail, for joining us, and really appreciate you taking the time out this evening to share. I've talked about the questions, so it's really very simple, easy. Treat it as a nice conversation in our rooms. You've been there here many a time, so just see it as that. And I think share what you feel comfortable to share. Don't feel obliged. So if you need to, like I said, off limits, just tell me, no, I don't want to go there. And
okay. Okay.
Thanks, Sohail. So Sohail, I thought, let me just start by asking you, tell us a little bit about yourself.
Well, I'm 52 years old now. I'm a businessman. I'm involved in the fuel business and in doing developments in student accommodation. I was married for. I'm still married for 26 years. I have a 36-year-old daughter. I have two grandkids, and that's about the nutshell with me.
About yourself.
Keep healthy and I keep fit. I try to keep healthy and keep fit.
Well,
yeah, that's about me.
Well, you're very successful and very healthy looking, and you take care of yourself, and that's great.
Yes.
So, what have you been struggling with? When you sort of came up with the idea that I need help, what were the difficulties? And as I said again, just share what you feel comfortable with.
I was the type of person who didn't believe in things like depression. If somebody came
Uh-huh.
to me and they told me that they were depressed, I'd tell them, "I just snap out of it, just snap out of it."
I
So
know.
until it hit me, and it hit me very, very, very hard. Over the past 4 years, I was in and out of depression, and I was going through a lot of personal problems. My wife and I had split up about 4 years ago, and I moved down to KZN, and I was traveling between KZN and Johannesburg to see to my business here and to see to a business that we had started up in KZN, and I was going through a lot of emotional
Turmoil.
pain. I'm a very tough person on the outside, but I think I'm very, very soft.
Softly.
Yeah, and I think people expect the same, from the outside, what they see on the outside. They think you like that on the inside as well.
Yeah,
And
yeah.
when my wife had melanoma cancer as well, so we put the
Sure.
divorce proceedings aside, and I came back down to Johannesburg to see to her.
Yeah.
Um, Things just started happening in the past few years. I had a lot of losses in terms of friendships and in terms of love, and I just started digging myself deeper and deeper into a hole.
Right.
I became very depressed to a point where I was sleeping for 2 to 3 days. I was very lucky that I had good people that work for me. They were picking up the slack, and I have amazing friends. My closest friend Yusuf at the time was trying to find a solution for my depression. I went to psychiatrists. They put me on antidepressants. Some of the antidepressants didn't work as well,
Yeah.
and I was fogged up, completely fogged up. I just didn't know where to go, where to turn. I just packed the world completely off. And the one day, Yusuf was
Before you get there, about
sure.
Yusuf and how you chose or thought about ketamine
Yeah,
or Keta-Therapy, may I ask many a time people struggle with that idea. You yourself said, I mean, depression, snap out of it.
yeah.
What was your experience in that state to say, what depression means for you? You mentioned that you were sort of sleeping and in bed for days, but what are the other things that you were struggling with that characterizes your experience of depression?
I think you don't want to be surrounded by people. You don't want to talk to people. I mean, I stopped eating almost completely. I
Right.
wasn't interested in any food. I lost considerable amount of weight. I
Uh-huh.
found me. I'm very meticulous about certain things about how your home looks, how your bedroom looks, and personal hygiene as well.
Yeah, yeah.
I mean, I found myself just not caring. I'd
Right.
sleep in the same clothing for 2 to 3 days. I'd get up and only because of the smell, I'd go and have a shower.
Sure.
So
Well,
so
it's
it
not.
yeah, so that was about, there's a lot of other things that came with it, but that were the serious points where I knew, okay, there's something definitely wrong with me.
Now, like you said, it, it is something that things that people is that are normal, but you felt stuck in a hole and couldn't snap out of it. What
No,
what do you think about that idea of what depression feels like when you can't snap out of it?
no, it's
What does
overwhelming.
it?
It's
Yeah,
completely overwhelming. I mean, it's not you, firstly. You don't want to be in this place. Your heart literally feels like like it's hurting. Your brain is completely fogged up. You can't see the light. You can't see anything in the future. You just want to die. I'm not a suicidal person. I have
sure.
to tell everybody that now. I never
No,
um,
of course.
considered suicide, but I always used to say, when people ask me, I would say to them that if God said this is your time up now, I would be okay with it. I would gladly go. It's
Yeah.
so that's what
That
I
is quite common, actually, that, people don't like thinking that they're suicidal or contemplating that idea. But many a times in the psychiatric space, that is a very good indicator of how bad things are.
yes.
Um, And in fact, that is almost a screening question. But I find that people will say, no, I never contemplated that. But if you turn the question around to say, have you ever wished that you would go to sleep and not get up again? And many more people say that, you know
Sure.
what, I don't want to kill myself, but I don't mind, like you said, if today's my day, that's fine. I'll be happy. And
Yes.
it speaks to how deep that problem is for people.
Absolutely. I mean, for somebody to wanting to end it, people want to live long and they want to see the future and they want to see their grandkids grow up and so on and so forth. For somebody to be in that mindset, it will
Yeah.
tell you how down they are and where they are in terms of the hole that they're in.
Yeah.
You look up and you can't see the light. You just see darkness.
Yeah. No, for sure, for sure. Well, let's come back to how you landed up saying let's consider the Keta-Therapy. You were talking about Yusuf and him looking around. Perhaps you can continue there.
So Yusuf is much elder than I am, and obviously a lot wiser than I am. He's an amazing person. He's my very close friend. I have a great deal of respect for him, and he's my mentor as well. And he was very concerned about my well-being, and he started looking for places that could assist me. In fact, the psychiatrist that I was seeing at the time wanted to institutionalize me into a rehab center for 28 days. He was very concerned about my well-being, and then I just got a phone call from one of the managers at my business. He manages one of my businesses, and he's also quite close to me. And he said, "Okay, you get ready. I'm coming to fetch you." And they came. They fetched me, and I remember walking in through the door, and I could barely look up. Um, um,
No.
I looked like death, like something had run over me, put it in reverse, and came back the other way. And I was completely distraught. I couldn't see anything in front of me, and we sat there for a while, and then I think somebody indicated that it's going to be a little bit longer. So Yusuf took me out for a drive, and we came back, and obviously eventually they put me into the chair um,
Yeah.
there, and I sat down, and I was very curious, even though I was in the state. But at that point in time, I can tell you that I was willing to try absolutely anything,
Yeah.
anything crazy as well, for me to snap out of this depression that I was in. And I was very skeptical, about it, but I was really willing to try absolutely anything. And yeah, you explained it to me. I first told you a little bit about myself and what I was going through, and the process started.
Yeah.
And
Before you go to the process started,
yeah,
I want to ask you, you obviously said you went to a psychiatrist and got
yes,
some help and it didn't help you. I mean,
no,
most people it does help, well, up to 60% of the people it helps, but some people it doesn't. They go through
sure,
multiple iterations of drug and it doesn't quite help, and sometimes it tends to create more problems than help. What
yes.
about psychotherapy? Did you find that? Were you having a psychologist that you visited?
Sure. In my view, from what I had a psychologist that I was seeing as well, and you'd sit there and you'd talk for an hour or 90 minutes, and you just get into the flow of things, and they'd say, "Okay, time is up. We'll see you next week, or we'll see you tomorrow," whatever the case may be.
Right.
There's not there. I didn't find, there wasn't that real empathy or really concerned about. You felt like I felt like I'm a kettle. Like you just one after the next.
Right.
And you're not. You just talk and you talk and you talk and you talk and you talk for ages and ages and ages. I mean, what ketamine has done for me, I think would have taken years and years of psychotherapy for me to achieve.
Yeah.
That's my dead honest opinion. I wouldn't endorse anything that I haven't experienced myself. I mean,
Yeah.
what it's done for me is absolutely amazing, and the people around me can testify to that as well.
Well, we'll come to that question of how it's impacted on you. Before
Sure.
we get there, I mean, obviously a lot of people, like you were saying, part skeptical, but also part anxious. What does this mean? Because the the idea of psychedelics comes with, oh, that's like party drug, and am I
Sure.
going to be addicted to this? What
Yes.
was your fears about considering this? I know you said you're willing to try anything, but what were your anxieties around it? And also, we'll come to when you were in it, what it landed up to be.
I have an addictive personality. Um, because I have been previously addicted to hard drugs,
Right.
and that was my first fear. Obviously, is to like it so much that I'd want more and more and more, and obviously become an addict on it.
Yeah.
That was the first thing, and the second thing that I had was that maybe it's going to maybe I'm going to go further back into a depression.
Right.
Maybe I'll experience something that will just make my mind snap. So I was afraid of it in that sense.
Yeah. Yeah.
But
Justifiable.
those were my big fears. Yes.
Yeah, and I mean these are justifiable concerns, and something that we would, we've explained to you that there is no addictiveness to uh, any of the psychedelics. Obviously, it's psychological. You can like it and want to come back for it, but you'll never have a biological addiction or
Yes.
urge for it. So if you once you take it and you stop it, you don't feel like I have to have it, and you're sick because you don't have it. So yeah, but it's a genuine concern, and I mean, it is in fact a very deep experience.
Yes.
So, like you said, what will happen, and so tell us. I mean, for you, what it felt like. I know I spent quite a bit of time trying to make sure that
Yes.
patients understand this very well. They know exactly what's going to happen, minute by minute, and are reassured and that I'm there and that we're working with you. But
Yeah.
what was it like for you? I mean, it's very hard to describe. So give it your best shot. What was it
Sure.
like once what was the process for you?
Sure. Prof. I've had one of the best experiences in my life ever. When I was under or when the infusion was taking place. So the first one was good. I even woke up there and I looked at you and I said, if you can remember, I said, you're the best drug dealer ever. If you can remember, I said, because I didn't
As
expect
in,
that.
please don't repeat that.
So I didn't quite experience that, but even after my first infusion, Yusuf was taking me home, and I was driving, and already in my mind's eye, I felt a lot better. I really felt a lot better, and I said to him, Yusuf, I know exactly what I need to do in order to get my life together. Then we
Uh-huh.
had the second. We had the second infusion, and it was okay. But on the third infusion, um, I mean, I'm only saying this. Oh, people on this webinar are probably going to think I'm crazy, but I'm a Muslim. I'm a practicing Muslim, and I literally met the Almighty God. Um, I'm sure it was all subconscious. I didn't meet him in the sense where I spoke to him. I met him in the sense where I felt his presence around me. I started praying while I was under. You were there. You
Yeah,
you you
yeah, yeah.
you saw all of this happen,
Seemed a very
and
profound experience.
yes, it was absolutely amazing. I mean, I woke up from there. I felt God was with me, and when I was coming down, well, part of it was, I always get excited talking about this because I asked him uh, for him to show me paradise, and
Right.
everything I was about to see, but I didn't quite see it. And I remember I was flying through the sky and I felt his presence with me. And when he left me and I left him, I felt the sadness. And I said to him, don't leave me. And this feeling overcame me where he said to me, you're never alone. You're never
Yes.
alone.
True, true.
And I woke up from there and I hadn't cried for years. Literally, I couldn't cry and I started weeping. I wouldn't be saying this if there were not two
No.
witnesses in the room. Prof, you were there, and I started weeping, and it strengthened my faith in my religion. I literally I feel that I was meant to be there. I feel that I was meant. I don't believe in coincidences in life.
Sure.
And it was I even remember after that I said to you, Prof, I think I don't want another infusion. This is it. I'm done with this infusion because I can't top this experience, you know. And then you said to me, look, so it's not about the experience. It's you've got to do the full course. We've got to finish it. But nonetheless, I obviously did finish it.
Yeah.
I didn't have the same experience that I had, but it worked for me in the most amazing way. I saw the change in me after every infusion. I got the energy level of mine just rose. My mind started working overtime. I even cleaned up my file 13, you know, the stuff that you put in for
I
years and
know,
years,
I
and it
know,
just piles up,
I
piles up.
know.
And yeah, that has been my experience. I mean, I've become one of your greatest advocates because of what is done for me as a person.
We're
And
glad.
I think it's this ketamine is a great threat to the psychological world, where you sit down with a psychiatrist and you need to go on pills and so on and so forth. I think it's also in terms of money. You know, I mean, what you spend with a session with a therapist is crazy, and it takes you years and years and years. And you know, sometimes people exhaust their medical aids just trying to find a solution to their lives.
Yeah, yeah.
And I mean, anybody that comes to me with this problem of depression, and so we send them to you. You know, so
Well, it works a charm, and I think that's really wonderful. And I mean, like you mentioned, it can be it is a profound experience, and it is literally, like I described to patients, your ego dissolves, and that can feel literally what's going on. You almost feel like you are dissolving, and it can be very spiritual. Depends on your own. Remember that you, as a person, are literally engaging with yourself. So that spirituality manifests in terms of your beliefs coming forward and being confirmed. So it can be very spiritual for many people. And every experience is different, both for you and for other people. But in the main, it is that kind of very dissociative. The dissociation is really that you become dissociated from reality, and that can feel very different. It needs people to help them through that process, and we try to do that. So I'm glad that it was a very good experience. Many people come with fear, and it can feel initially a little bit anxiety provoking, but 90% to 99% of the people come out and say, you're the words of wow, weird, wonderful. And it is, like you said, a very much of that kind of experience. And I'm curious to know, you've mentioned already that its help to you was, it got you back into doing things, getting out of bed, getting on with things. What about the way it made you feel? I mean, I'm sure that it was positive, but can you share what that difference in feeling was like? And also, what was it in terms of your thinking? Because you mentioned fogginess, etc.
yes. So the fog completely cleared up. I think after the third infusion,
Uh-huh.
my mind was crystal clear. You know, I was functioning on all cylinders. My energy level had risen. You know, I'm an insomniac, but I actually found it a little bit difficult to sleep because I was just doing things and working, you know, all of the time. And I just went. I mean, people don't recover that fast from a serious depression, and I had a serious case of depression,
Yeah.
and it was just the most amazing experience in my life. And I mean, I'm not one to kid myself about things like this. You know, I went in being a skeptic, and I've come out being one of your greatest, or one of ketamine's greatest advocates. You know, I just think that, you know, the medical aids need to have a look at this, and
Yeah, yeah,
it needs to become accessible to more and more and more people. I think
absolutely.
that there are a lot of other people out there that would have a similar story like mine,
Yeah,
going on to the ketamine infusion after, you know, being psychologically impaired, or, you know, people that have depression, or people that are addicts and so on and so forth.
yeah.
So I think it's really assisted me in a lot of ways. I mean, there are times that I get a little bit low and I go down and I don't revert back to my pills. You know, I come to you and we do an infusion and I'm back on my feet, you know. And I see it getting better and better where the space of depression is longer and longer.
Yeah.
So, you know, it's less frequent. And the depression is not as bad as it used to be. It comes and it goes quickly.
Yeah.
And it's assisted me in ways, you know, if you were me, you would only be able to understand.
No, no,
And
no problem.
and I've done things that I said I was going to do for years. You know, unfortunately, my marriage had fallen apart, and you know,
But
I still.
wasn't that quite an important issue as well? In a way, one of the things that the Keta-Therapy does is it helps people get a better sense of themselves and
Absolutely.
their self-esteem and also boundaries. They manage boundaries better. How did that translate for you?
Oh, it helped me make the right decisions and make the right choices and not kid myself about certain things. So the clarity in terms of thought um, was was there. You know, after the infusions, I knew exactly what it is that I needed to do to get back on my feet. I had to
Yeah,
finally take action. I mean, the height of insanity is doing the same thing over and over again, expecting a different result.
yeah,
And most
yeah,
of us, we tend to do that. You know, we
yeah,
tend to repeat the same mistakes over and over again because that's our comfort zone. That's what we know. Ketamine has helped me come out of that comfort zone and it has helped me look at things from different perspectives.
yeah.
And once I've done that, I've now found that I find solutions to things a lot better. I'm a very calm person now. I'm a lot well. I'm a lot calmer
I know.
than I used to be, and I handle conflict a lot better now. You know, instead of screaming and shouting, you know, I tend to try to calm the situation down first, and then
Yeah,
and then speak. And you know, people that are around me don't know me like that. You know, they just think, okay, he shouts all the time, or he screams at things
yeah, yeah.
all the time. But you look at things from a different perspective, and that's what ketamine has done for me.
Well, wonderful. I mean, what would your advice be to others who are in this position where they're battling or any of these conditions that we've talked of, in terms of taking steps? What would you advise them to do?
So you've got nothing to lose. That's the first thing. I mean, ketamine, like the prophet mentioned, it's not a drug that you can get addicted to. You've got really absolutely nothing to lose. I mean, in terms of percentage, I think you said to me, I think if I can remember, the 70% success rate, Prof.
80%. Yeah.
80% success rate. I mean, in terms of that, the odds are totally stacked with you. You know, they're
Yeah.
not against you. So the success rate, and in terms of the period or the time it takes in order for you to find solutions, is a lot shorter.
Yes.
Psychotherapy can take years, and then they're still going to experiment on you with different forms of antidepressants. Oh, this one works, that doesn't work. Okay, you need to mix this one. I mean, I didn't know that you could take more than one antidepressant. I mean, you know, going through this thing, I found out some people took 30
Yeah.
antidepressants. I was like, okay, I don't get it. So it's you just become an experiment,
Yeah.
and they try to find the right dosage for you and the measurement, and it's a frustrating thing. And sometimes you go up, sometimes you go down. You
Yeah.
got nothing to lose with ketamine, absolutely nothing. I mean, firstly, from a financial perspective, I mean, it really saves you a lot. You know, it's going to save you as the individual as well. It's going to help you think better, think properly, and in a much shorter space of time. I would definitely
Yeah.
send anybody that I've felt that was in that position, even for fatigue. You know, it's amazing what ketamine does for people that are tired.
Yeah.
So it's a no-brainer.
Yeah.
It's a
Now,
no-brainer.
and I mean, I think a lot of people don't realize when you look at the symptoms of depression, like you said at the beginning, it doesn't feel nice to label yourself. And I'm not very fussed about the labels, but the sets of issues that you struggle with, fatigue, no interest in things, no energy, poor concentration, these can just feel like, what an average person just goes through. But when you put them all together and they last for very long, that's depression and you're struggling with it. And many people are not appreciative of the fact that they are struggling and need the help and could get the help. So, thanks for that. I think that, the cost you mentioned as well, in some ways, it may be a hefty cost once off, but people can go through medication piles for months and months and months. Like you said, tinker around with psychotherapy for months and months and months. Now, I'm not a one to say psychotherapy is bad, psychomedication is bad. They all have a place, but it needs to be that it's seen as complementary, and Keta-Therapy fits in. It's one of those opportunities to make a difference, and so it's worthwhile considering, like you've advised.
So I think that from a perspective of that is that psychiatrists and big pharma, they're blocking things like this. They don't want it to become big because it's going to affect their businesses. It's going to affect their back pockets. I mean, can you imagine what pharmacies and pharmaceuticals are making just on antidepressants? I mean, every second person you meet today is on an antidepressant.
Yes.
So the amount of money they make off these things is just, it's massive. And I mean, if more people cottoned onto this, we'd have less people on drugs and more people living happy, healthier lives.
Absolutely, absolutely. And I think that's the purpose of this webinar, is to in fact share, real life experience with it and allow people to share their experience with getting benefit, and maybe convincing other people who, that this is worthwhile, and create a movement in a way that says, listen, this needs to be taken more seriously and made more accessible, like you said, by medical aids. So I hope that we can continue to the new year to repeat this, and it's based on really people like yourself, Sohail, who are willing to come out, share their experience and what it has done for them. So I really do appreciate it. In closing, what would you say is the AYZA Health difference? I mean, there are a couple of people, if you Google, you'll find there are a couple of people, but what would you say is the difference with AYZA Health that you think, go there?
It's a personal touch, Prof. I think your empathy, first and foremost, is what stood out for me. Understanding where we are in terms of people, going through the process and making us feel safe, because it can be scary, because where you go to when you're that, it's just some amazing places that you go to, and it can be very scary because some people have never experienced things like that. Some people had never taken a drug in their lives or smoked marijuana in their lives, so they haven't experienced any form of that in their lives. So and just the way you conduct it, and the safeness of how you make us feel. I mean, you feel safe to let go when you in the AYZA presence. You guys are fantastic, Prof, and you're always accessible to us as well. And I don't feel that I don't feel like a number there.
Yeah.
I really didn't feel like a number there. There was empathy from Aisha. I've met your daughter as well, and from yourself as well. It's that personal touch, Prof. Don't ever let go of that personal touch that you put in there, because I think that anybody can put a needle in your arm and let you go on a trip. Anybody can. But I think that the fact that you are there, that you administer these things, people have a sense of safety.
Yeah. No, thank you. I mean, that's really important to us as well. I mean, I think that this is, for us, has been a personal journey. And for us also, that what drives us is really the personal journeys of our patients, that what they benefit. And it's been just so heartwarming. It's a challenge for me to even do this as an after-hours practice, but what keeps me keep doing it is the benefits it seems to provide to many people like yourself. So really, I appreciate what you've said. I just have some questions from people in the webinar, and I think Anika asked the question. What was your experience with Prof Moosa and the psychologist you went to? Maybe you can share a little bit about that and what you see as the difference between medication and ketamine or Keta-Therapy.
So I think the psychologists and the psychotherapists, they want you to find a place where things all started. They make you talk and talk and talk, and then they try to work themselves backwards in order to find solutions to your problems.
Yeah.
and they combine this with drugs, that stimulates the dopamine in your brain, or the serotonin in your brain, in order for you to feel better.
Yeah.
Um, with ketamine, it all got to do with the synapses in the brain, which is a very scientific thing. And it's the process is, first and foremost, it's a lot shorter in terms of, with psychotherapists, it will literally take you years to try to resolve your problems, and in the interim, they try to find the right dosage of a drug in order to keep your brain in order for you to keep you happy, and you become dependent on these drugs. You literally become weaning yourself off it is very difficult. It took me 3 months for me to wean myself off because I tried to stop it dead, but it wasn't a good idea, and I
Yeah.
had to wean myself. I had to wean myself off the antidepressants, and it's something I just won't go back to.
Yeah, yeah. Well, that's great. I mean, I think the idea that you don't even need these, you are not on any antidepressant right now, and you are good and fine. I mean, you mentioned a few things that are actually quite important to note. When you have what ketamine, Keta-Therapy does is essentially it's very fast acting.
Yes.
So you get a result, and in fact, it's the kind of therapy where there is in the psychiatric domain only one treatment that is very instant, very quick acting, and that is electroconvulsive therapy, shock therapy, where they tend to
Yes.
shock you. Exactly. Now that therapy has got a lot of side effects. It's got memory loss, lots of pains, and these can last for weeks. But you can get shaken out of that depression literally very quickly. And but it's got to be done in hospital. It's done for very serious patients, and of course, it's got its problems, like I mentioned. But a head-to-head study looking at Keta-Therapy with ECT found that Keta-Therapy is just as effective as ECT, but without all the problems, without all the side effects that come with the ECT. So it is really that effective, and I think that also, like you mentioned, it is not a drug that you will have a problem with afterwards. Literally afterwards, the only side effects are, nausea a little bit, maybe a headache, maybe some spaced out feeling for a few hours. The next day, maybe a little flat, but otherwise nothing much. And you don't have all this difficulty. Once you stop, there's no all of that difficulty, like you say, coming off it.
Absolutely. I mean, it's not like coming off a night of partying with cocaine or ecstasy or MDMA or whatever your preference of drug is.
Yeah.
You come off and you literally have a hangover, if you can call it that. Ketamine doesn't have that. I mean, you do feel a little bit lightheaded, and you just need to find your balance a little bit.
Yeah.
But no, it's nothing at all like that. You don't feel like you've had a heavy night out or something. In fact, the
Yeah.
night where you've had your ketamine, that night you sleep. So it's a fantastic sleep.
True, true. The value also, I think, is that you are having a treatment that is effective quite immediately, that doesn't have too much of side effects, and I think produces results quite quickly. You've also mentioned, the psychotherapist, and in a way, one of the things which I quote to patients is to say that ketamine or Keta-Therapy is really like a big jolt to your psyche, essentially your unconscious, subconscious, where a lot of behaviors get accumulated into a rut. That behavior where you don't understand why, but you're doing things in a particular way. It shakes it up, and suddenly all sorts come up, and like a snow globe gets shaken up. These all get settled down, but 95% of it's all subconscious, unconscious. And so, like you said, a lot of things get resolved in you,
Yes,
are you, not even consciously, unconscious, subconsciously. And then
yes.
you just feel like, whoa, everything's feels clearer, feels better, and there you are, with a big difference.
Yeah, I
So,
think also a big part of that is that you find solutions. But I've found solutions to a lot of my problems,
yeah,
and that I can I from the first. from the first infusion, I knew what it is that I needed to do in order for me to come out of this rut that I was in.
Yeah. Well, thank you very much. I think we've had a really productive conversation, Sohail. It's been quite useful. I think there's a lot of the science of it, a lot more detail of it. So if any of those watching would like to look at AYZA Health and the website, there's a medical professional part where you can look at it and understand more of the science. I think, like Sohail has just mentioned, it does not work on just one neurotransmitter system in our brain, but in fact has an effect across the multiple neurotransmitter systems. But a lot of that detail is there in the website, and when we meet, if you join us, I think we can go through some of that detail. So I don't know if there are any other questions, comments. I think we've had quite a few, and I think, thanks, Sohail. Really appreciate this. I think if there are no other questions, we can close it. But I really appreciate you taking time out, Sohail, to share what it's been like. We will be, to the rest of you, be coming back next week, Thursday at the same time, and we'll have another patient who I think will share his experience, and every one of them has a unique experience. And I think through that, we'll find ways to share bits and pieces of this approach, new approach to dealing with mental health. So thank you all. Thank you, Sohail. And thank you all to the viewers. And we'll see you. Bye-bye now.
There's one more question from
Oh, is there one
Yusra.
more question?
Yes,
Oh,
just
the question,
from Yusra
can one
Omar and
do
Aisha.
ketamine infusions whilst on antidepressants? Yes, it can. We do want to, we find that patients struggle to come off it, and it takes time, and they can struggle in that period. So what we encourage is that they come consult, and what we'll see is which type of antidepressants they're on. Often it's not the antidepressant that is the immediate problem, but there can be other drugs that are thrown in, especially mood stabilizers that can interfere, or benzodiazepines that can interfere. And so I'd need to go through your list of drugs to see how we can manage that. But antidepressants, patients stay on it sometimes, but many a times they feel such dramatic improvements that they ask, do I need to continue? And I say, listen, if you want to, you can wean yourself off it using this period with the Keta-Therapy to come off it, and many do. And they quite welcome that idea, because many of them are struggling with the difficulties or the challenges with the drugs, the multitudes of drugs and the side effects from them. So thank you. Hope that's answers your question, and any more. But thank you all very much. Appreciate all of you attending, and wish you all well, and see you next week if you want to join again and meet another patient from AYZA Health, where we'll talk about psychedelics and its impact on mental health. Bye, everyone.